This podcast is a production of WCWP, LIU Public Radio. Check out our lineup of original programs, listen live, or support by visiting WCWP.org.
The following is a presentation of Project Independence and WCWP. Project Independence is the Aging in Place initiative of the town of North Hempstead. We provide programs and services designed to assist and support the older town residents who wish to remain in their homes as they age. If we don't currently provide a service, we will try and connect you to that service. Call 311 or 869-6311 to get more information or receive services.
Welcome to Project Independence and You.
Welcome to Senior Talk Radio here on 88.1 FM and WCWP.org. This is Project Independence and You. I'm your host, John Ryan, and my co-host today is Otto Lohse.
Morning,
Good morning,
John.
Otto. And we have a wonderful show today, and we have two special guests. But before we get to them, I usually don't read stuff. I want to read something this morning. And this is from Margaret Mead, who's an anthropologist. And one of her students once asked her, what is the definition of civilization? And they were looking for the invention of fire or the wheel or whatever it is. And instead, Margaret Mead said that the first sign of civilization in any culture was a femur, that's your thigh bone, that had been broken and healed. Mead explained that in the animal kingdom, if you break your leg, you die. You cannot run from danger. You can't get to the river for water. You can't hunt for food. You actually become food so that other animals eat you. A broken femur that has been healed is evidence that someone has taken time to stay with that person, bound their wound, carried the person to safety, got them food, got them drink, etc. They saw them through the most difficult time. We are at our best, according to Margaret Mead, when we serve others. And actually, Peter, my partner, is the one who sent this to me, not knowing, planning for this show. But it is so true and it's so accurate. And today we have two guests on who are with hospice. The Mary Ann Tully Hospice Inn on Long Island, which is under Northwell. And with that, we have Jessica Dunn, who is the director of the social work for the hospice. And we have Kelly Tully. And Kelly Tully is the youngest daughter of Mary Ann Tully, who the hospice is named after. And actually, Mary Ann Tully died 15 years ago, died much too soon. But the legacy lives on with such a phenomenal hospice. And we're going to talk about that. We're going to talk about hospice, and we're going to talk about the Tully family and what they've done on Long Island. I'm going to start with Jessica. Good morning, Jessica.
Good morning.
I would like to start with a general definition of what hospice is. A lot of people don't know.
Sure. So hospice is a philosophy, right? It's a end-of-life philosophy about the way we're going to deliver care to a patient and what the goals of care really are. So a lot of people define hospice as a place, and sometimes it is. In the example of the Mary Ann, Tully Inn, it is. But hospice in general is a philosophy about providing comfort care and quality of life care to people who have a life-threatening illness, a terminal illness. So hospice can be, for a year length of time. It can be for a couple of months. It can be for a couple of days, whatever the patient's goals and needs are. So really in hospice, we're looking to manage symptoms, to provide quality of life. We're not looking to cure anything. So we're looking to enhance someone's quality every day and to make sure that they have the death or the end of life experience that they wish to have. That it's really patient driven.
It's so important for them to have peace. Just one second, Otto. Now I just want to introduce Kelly, and then we'll go to Otto. And from Kelly, what I'd like to know, just in a little conversation, and we're going to go back and forth, how did your family get involved in such a worthy endeavor as the hospice?
Well, my mom, I was a teenager, 13, 14 years old, and she had raised 7 kids, and she wanted to do some volunteer work, and she ended up volunteering as a caregiver for hospice. And I think it just grew there from her. That's what my mom did. She got herself involved in something and she made it bigger and better.
Perfect. And then obviously after your mom died, but then we're going to talk about that.
Yeah.
The Tully family then stepped up. Otto, do you have a question?
Yeah, as I mentioned offline, we're involved with hospice right now with a family member. Who decides that you are now in hospice, if you will? Do I, as the patient, does the doctor? Who kind of gets the ball rolling that you are in hospice? Like in some cases that I've been involved with, the patient themselves really don't know they're in hospice. They've never were told. So I'm just curious, how's it start?
Sure. It can start a couple different ways. It can definitely, it's best started by the patient's physician and a physician that they would have known for a period of time. That's the best case scenario. It can also be started by if a patient's in the hospital and that's deemed by the case manager or the palliative team or the doctor involved in the hospital care. And the patient themselves can also, start the referral process. But once a referral is placed to hospice, whether it's by the family, the patient themselves, a doctor, a case manager, then the patient and the family are definitely talked to about whether they want to elect hospice coverage. So it's supposed to be a patient's decision, if they're able to make a decision for themselves, to elect that, because it is a benefit. It's a Medicare benefit. So the patient themselves, if they have the ability to make their own decisions, is the one that should be making that decision for themselves. But a doctor would have to certify that they would be hospice eligible.
Unfortunately, sometimes patients probably are not able to make that decision, and somebody has to make it for them,
Yes.
which is one we're involved with. The patient just can't do it. They can't make the decision.
But in my opinion there, Otto, if a person is not basically awake or they're in a coma and they can't make that decision, and Jessica, you can come in, I think hospice is less important. I think hospice is important for the person who knows they're dying, but is cognizant of the fact that they're dying. If you need a guardian to sign the paper, whether you're in the hospital or in hospice, it makes no difference. But if you know you're dying and you're on morphine, it's nice to have somebody come in, touch your hand, give you breakfast, and tell you what's going on in the outside world. That's how I look at hospice.
Well, I think it's important for kind of everyone along the spectrum. There's a lot of patients who, might be able to participate in conversation, might be aware of who they are and their immediate familiar surroundings, but they might not understand medical decisions or, the full extent to what their disease process is. So for those patients, that might be someone where their healthcare proxy might make the decision for them. I think hospice is really important when people are, very sick and maybe not able to respond very much, because that's when families have a very difficult time sitting and waiting and caring for them. And that's where we find that we can really be supportive in telling them they might not be able to respond to you, but they can hear you. They might not be able to respond to you, but they can hold your hand. So we do the whole trajectory. And if we can start out with a patient that can respond to us, can talk to us, can know who we are, then we can find out what their end of life goals are and help the family to feel good about how they're continuing to advocate for them and honor their wishes at the end of their life.
Perfect. I'm going to shoot back and forth because we have an organization like hospice, but also it has to be paid for. And I know that the Tully family had their golf outing this year, but it was virtual. Mm-hmm. And still successful, Kelly, excuse me.
We didn't do anything this year, but we still raised a significant amount of money. We did nothing.
Oh, I thought you did something. Okay.
No,
it was just
we did nothing.
Matter of you guys reaching out via letters or something, or?
Well, so the process of planning the golf outing started, and we were hoping to be able to do something, but in the end we couldn't, because it wasn't, people are paying for something, you want to give them a service,
right?
But it was almost easier not to give them a service than to offer them minimal. And, we offered people refunds and they didn't want it back. They were willing to, continue to support hospice another year without, getting their golf round in.
Right. But you see, something like that is also, I mean, it's not only what the hospice is providing, which is tremendous, but you and your family and your friends who you reached out for. And I believe the number was like $170,000 for this year.
We raised over 200,000 this year.
Over 200. And nobody got anything for it. What they got was they know they were helping another human being.
Right.
And that's the best gift you can get, that you sat at night and said, guess what? I'm fortunate enough to write a check for 100, 500, 5,000, whatever. And I don't need it, but maybe someday I will. And when I am in that need, I can call an organization that Jessica's involved in and say, what do I do next? I have to get my mom, I have to get my brother, or somebody in there. It's tremendous that, and I know there's other people involved and so I'm not just saying Kelly's family, but for this particular place, how it has come about, I think it's tremendous. And it has to be stressed. One other thing, and again, we have plenty of time, and we'll tell the story. We're going to have a break coming up, believe it or not, is you guys, and this goes to Jessica, have a very liberal, not crazy, but liberal visiting program, which is so important. Knowing that a person's going to die, and I'm saying now because of the pandemic. I'm not talking normally. In normal times, I don't know what the schedule is, but everybody shares it. Now it's terrible when you put a person into a hospice or a hospital and you may not see them again and you get a call a couple of weeks later. You guys have done, with screens and plexiglass and everything. Just tell us about that. Sure.
So I work at Hospice Care Network, which is the larger organization, and the hospice, the Mary Ann Tully Hospice Inn is a program within that. So at the Hospice Inn, pretty early on in the COVID times, our director there, Darren London, was very bothered that.
You know what I'm going to do? I'm sorry, Jessica. I thought we were going to be able to get this in, but we got to go to the break. But we're coming back from the break. We're going to start with that. You're listening to Senior Talk Radio here on 88.1 FM and WCWP.org. We'll be right back.
Project Independence is the Aging in Place initiative of the town of North Hempstead. One of the many services we offer is transportation for food, shopping, and medical visits. Call 311 or 869-6311 to get more information or receive services.
Welcome back to Senior Talk Radio here on 88.1 FM and WCWP.org. This is Project Independence and you. I'm your host, John Ryan, and my co-host today is Otto Lohse.
Still here.
And thank God. And we're having a wonderful conversation with Jessica Dunn, who is the Director of Social Work Services for the Hospice Care Network, and Kelly Tully, whose family is a major contributor to hospice on Long Island, and very specific, the Mary Ann Tully Hospice Inn. And we had a question that we're going to go back to Jessica with, but I just wanted to, in the brochure that Christina had sent out, and this is a quote from Mother Teresa, none of us, including me, I suppose she was talking about me personally, I'm not sure, ever do great things, but we can all do small things with great love, and together we can do something wonderful. And this conversation today is the epitome of that. The Tully family helping out, and Jessica organizing, et cetera, et cetera. Every piece of it is just a small part of the puzzle. But at the end of it, we have given somebody a peaceful end of life, and we have given the family some solace in the most terrible time of their life. So again, to both you ladies, it's just nothing but congratulations and thank you. Just go back to what we were talking about.
Sure. So we were talking about visitation at the Hospice Inn.
Good. I didn't remember that. Yeah. I hope you remember what we were talking about.
Yes, which early on in the pandemic, our director at the Hospice Inn, Darren London, was very dedicated to trying to figure out a way that we could help to get some of these patients to us so their families could see them at end of life. So we took our first COVID positive patient, I think pretty early on in the pandemic, and, kind of went through with the staff to make sure they were comfortable and they were safe and the PPE guidelines were all understood. We were one of the first that allowed visitation. And not only for the COVID patients, it was also a concern for the patients that were there for, other illnesses, because people were still dying in the height of the pandemic from other illnesses. So it was important that they got visitation as well. So we started doing, of course, limited visitation, 2 people at a time for 2 hours a day. And then as things got safer, things opened up more. So it's really a great kind of partnership between the staff and the families to educate them and make them feel comfortable, to do the proper PPE, to be safe at the bedside. If families weren't able to be there present, and maybe they were sick themselves, or they were at a distance, they couldn't travel to see their loved one as they were dying, then our staff, especially our social work staff, would facilitate FaceTime calls or Zoom meetings with family members so people could see people in different ways. And then that kind of visitation was opened up in that model in some of our other units, in some of the hospitals, in some of the nursing homes, that if a patient was imminently dying, then they were allowed visitation.
Do you
Go ahead, Otto. Go.
visitors is a subject that everybody handles things differently, and there are some people who don't handle things like this too well. Do you try to prime a visitor before they come in, on maybe how they ought to try to behave, even though it's difficult? Yeah, I've been there, and I've seen people do some really crazy things, and it doesn't help the patient. So I was just wondering what the thinking was on that.
So do you mean emotional reactions, things like that?
Yeah, well, somebody comes in and, I understand people will be upset because when you see people in hospice, typically they're not at the top of their game. And some people can handle that and some people can't. And they probably do more harm with their visit than they do good. And I was just wondering if there's ever any thought given to, trying to kind of encourage people to try to control a little bit what they're doing when they're in there.
So I think sometimes those reactions that you're speaking about happen when the education maybe isn't there. Sometimes I think we misunderstand some of the practices we have at end of life. Someone mentioned morphine before. There's a lot of fear around morphine. Sometimes when we mention morphine to a family, they might get very upset. They might have a kind of adverse reaction. But the more we provide education and what the kind of intent is for something, or the condition someone might be in, what's happening to their body, that can really help people to cognitively understand, that then can help their emotional reaction to things. So we try to do that to kind of more empower people with the information and inform them of what they're going to see. And then that should help with, letting them be present with that person, as opposed to getting caught up in their head, wondering, what am I seeing? What's going on? How can this be happening? So we work really well as an interdisciplinary team of course, at the Tully Hospice Inn and elsewhere in our network. But we try to really work with the nurse and social worker together and the chaplain to really provide that interdisciplinary support. So the doctor and nurse can say, this is medically what's going on. The social worker and chaplain can pick that up emotionally and spiritually and see how the family's processing that.
That was a great question. And Jessica, thank you. But at the same time, there comes a point where you can't control what people do and say. And this is a true story. My father went to a wake years ago, and it was a woman's wake. And he went up to the son and said, your mother, when she was alive, was never a good looking woman, but they did a great job on her now.
Oh, boy.
I mean, you can't make this stuff up.
No.
And everybody in my family just cringed and said, oh, how would you say something like that? So, I'm agreeing, you want the person to go in and be encouraging, but a person is still, they are who they are at the end of the day, unfortunately. And when I'm talking about that, I actually want to go back now to Kelly, in reference to a little further in reference to the support that the Tully family is giving. And since you're the one that's on, I do want to give a shout out to your brothers and sisters. So you got to name them for me. I mean, I know their names, but that's besides the point.
You want me to name my brothers and sisters?
Yeah, go ahead.
All right. Well, Tommy's the oldest. Tommy, Joanne, Jimmy, Peter, Kenny, Alice, and me.
Perfect. No, I mean, because the other thing that's so nice about it is it's a family. Okay, so I mean, of the 7 of you, it's not you and Peter or you and Kenny are deciding we should support this.
No,
It's a collective effort.
yes, it was yes, as you know, after my mother passed, my mother was on the board at hospice, and after she passed, my father took over her position. And when my father passed away, we knew we were just going to continue supporting, something that was so close to my mother and my father. I think we will continue to support for as long as we possibly can. It's always been such a huge part of all of our lives. Since, like I said, since I was a young girl.
That's amazing. I didn't know that. And I know you and I know some of the story. I didn't know that. When did it become Mary Ann Tully?
When did they rename the inn?
Yeah.
I'm going to say 6 years ago, 7 years ago,
Okay.
It was renamed. I think it was built when my mother, maybe she had just passed, because I know she was very involved in opening it, but I think shortly after she had passed away.
Okay.
But my family's the golf outing itself to support hospice started in 1991. This year was the 29th year.
Oh, wow.
And I think my mother started it so that she could raise money, so that there was, they could do more work and more.
Right.
I'm trying to think of the name of they do so many things for children, and so many that have lost their parents, and things like that as well, so that there was more funds to fund those programs.
Okay. No, because I this one I really did read about, and there is so many auxiliary I don't know what you're going to call it, but side programs that need to be done. And the other thing too, and I have been involved in somewhat with nursing homes and hospices and stuff with what I do. But the Mary Ann Tully, it's almost decorated like a house. It's a very comforting environment.
Yes.
It's not sterile.
No. And the people are unbelievable, in the care that they give these people that are, passing. Both my parents were on hospice when they died, but they were at home.
Oh, really?
Mm-hmm. Yeah.
See, again, my opinion, if I was on hospice, I want to go to the facility. That's just my opinion.
And I think
I'd rather.
Each his own.
I know, I agree. See, that's why we're friends. When the time comes, I'm going to call you. Get me in. Call Jessica. Get me in.
Who makes that decision, by the way?
Good point. I have no idea. Jessica?
Well, that is a medical decision. So hospice is a Medicare-based program, so we follow Medicare regulations. That's also who the major pay source is for hospice is Medicare. So there's several levels of care within hospice, and inpatient care, which is what the hospice inn is one of those levels of care. So it's when a patient requires the kind of care that can't be provided at home, that's when it would be appropriate for them to be in something like the hospice inn.
Now, that's either going to be in the hospice or the same amount of treatment, or not treatment, the same care would be offered to them at home, excuse me.
Yes, so most
Am
of
I right
our
there,
patients,
Jessica?
yes,
Okay.
most of our patients, I'd say 95% of our patients are at home, or what they determine to be their home. So that could be an assisted living or a nursing home, or their home. And a lot of patients, kind of might go back and forth. If they have a period of time where they're more symptomatic, they might go into the inn, let us kind of take care of them, make sure that their care can be managed at home, and then go back home. That can work too. Some families are very dedicated to wanting to try to keep their loved one home, especially now with visitation and everything like that. Right. But some people are, feel that they would like their loved one to die in a facility. So we do our best to try and get, align that with people's goals.
If you have at home, what are the hours typically? I guess it depends a lot on the condition of the patient, but like, what's the deal? Like, is it ever 24/7, 8 hours, 4 hours? How does that work?
So if you're talking about actual physical care, like an aide,
well, somebody
or the hospice in general.
Well, and I guess that's really the question is if it's hospice care at home, what does that mean? Does it mean you have somebody there all day, 8 hours, whatever?
No, that's a great question because that's another kind of misnomer about hospice. So like I said, hospice is a philosophy and it's a way of care. So what we provide 24/7 is access to our medical team, access to medications, things like that. So if there's any sort of symptom that comes up, if there's anything that I always think our best services, that 2 o'clock in the morning kind of thought in the back of your head that you're like, oh, should I take him to the ER? Should I take him somewhere? That doesn't sound great. You pick up the phone, you call us, a nurse can come see you in the middle of the night. I think that's the best aspect, the best service that we offer in hospice. So it's not 24/7 physical care, but it's access to care 24/7.
But there would be some physical care if required with aides?
So the aid is usually there up to 4 hours a day.
Okay.
That's the maximum Medicare allows.
We got to take another break. This is tremendous. You're listening to Senior Talk Radio here on 88.1 FM and WCWP.org. We'll be right back with both Jessica and Kelly.
Project Independence is the Aging in Place initiative of the town of North Hempstead. One of the many services we offer is help at home with minor home maintenance. Call 311 or 869-6311 to get more information or receive services.
Welcome back to Senior Talk Radio here on 88.1 FM and WCWP.org. This is Project Independence in You. I'm your host, John Ryan, and my co-host today is Otto Lohse.
Great topic, John. Great topic.
It really is. It's the one thing that I like about this is it's a love. At the end of the day, hospice is love. People look at it like, oh, they're dying and stick them in the corner. That's not it. The definition of hospice is love. It's caring. And the reason I have both Jessica and Kelly on today is we have a family in the Tully family that has given millions of dollars worth of support to Jessica and the hospice organization so that they can provide the love to families all over Long Island. And that is, that's the end of it. That's really what it is. But just when we went into the break, Otto and Jessica were talking in reference to the time allotted at home and just go further into that because you got 4 hours if you're at home. But of course, if you're in the hospice environment, you're there 24/7. So anytime I want something, I can just yell for it.
Yes, theoretically. So I think, I just want to clarify that, hospice, the whole program is meant to be medical support. It's not, the intention isn't really what we call custodial care. So the physical care of someone, typically falls to the people that they live with, the people that take care of them, as they were doing before they were coming on hospice. So what we do is we try to add to that to make that a little bit easier for the family, to relieve the caregiver a little bit. But the program isn't set up to completely support all the physical needs of someone 24/7. What we are meant to do is to take care of the medical needs, to provide, that emotional support, that confidence, that training, that education to the caregivers at home so they can then provide the care or identify who they want to provide the care. So what we will do is partner with, usually it's family members, it might be a private aide that they've had for many years, it might be a neighbor, but partner with whoever they identify, the patient identifies to be their trusted caregiver to make it work for them in the setting that they wish to be in. So we provide all different kinds of services. Like I mentioned, the medical coverage, a nurse comes as needed at least once a week, but more if needed, to make sure that patient has all the medications they need, they have all the supplies, do any wound care if needed, educate on symptoms, tell people what to anticipate, what might be coming up, talk to the patient about their questions about their own, health needs. We also offer the social worker and the chaplain, like I mentioned, to deal, talk with them about emotional support needs, existential questions, spirituality. The social workers get very involved in the questions you were asking, Otto, about, how much aid service do you need? Do you need any more coverage? What other resources do you have? Can we talk about Medicaid? Can we talk about long-term health insurance? Is there, and also having difficult conversations with families. Maybe there's a large family and all the care is falling to one person. the social worker will try and help, everyone have that conversation about what's needed right now. Also, we offer volunteer support, which is how Kelly's mom got involved with hospice. And that's an amazing resource that we have, especially for those patients who are home most of the time by themselves, able to talk, able to converse, and really want quality of life. Our volunteers are amazing at giving them some extra quality, learning about them, looking at their pictures, sometimes watching movies, teaching each other skills, playing cards, those kinds of things that, maybe sometimes their caregivers don't have time to spend time with them like that. And our volunteers are amazing at doing that. So we have a lot of resources to make people kind of feel the love 24/7, even if there's not necessarily a home health aide there 24/7.
Does it happen that like we talk about an inn and we talk about home, does it happen that you wind up with hospice care while in a hospital? Is that?
You can. It depends on kind of the locations, but yeah, in a couple of the hospitals in the area, we have contracts or units in the hospital where we can provide hospice care in a unit in a hospital if that's needed. And that would be similar coverage to the inn, like we were talking about.
Right.
Jessica, do you have, which I haven't said so far this morning, a phone number to give out? I mean, we were just talking about volunteers. So if somebody does want, not now, I know it's very difficult. So I'm sure you're not getting phone calls for somebody who wants to come and volunteer. But a number they can put in their Rolodex to call, because I see there's even a student program.
Yeah, so the number is 516-832-7100. That's the main number for Hospice Care Network. So you can get to all of our sites within that one number. So that'd be the number for the Tully Hospice Inn. We use a lot of volunteers there as well. And, Nassau, Suffolk, Queens, that's what we cover. So yeah, we're always looking for volunteers. And also if there's anyone that just wants a little more information about hospice, if they think, I'm okay, I had this diagnosis, but I'm okay right now, but how would it help me? How would it benefit me? You can always call our referral department and see if it would benefit in any way.
Right. Another thing, I assume just by calling that 832-7100 number, I have a copy that Christina got me of a brochure that I'm sure people could just call for that brochure. It's a tremendous brochure covering all the various stuff that goes on in hospice. And one that I want to touch on actually now is pastoral care, which is important because, I mean, even just recently now in New York, we wound up with the governor and the church fighting about freedom of religion, etc. But it's important that people have to feel that just because they're going into a hospice environment doesn't mean they're giving up anything from a personal perspective, from a religious perspective, from a dietary perspective. No matter what it is, everything is being done to accommodate them. Mm-hmm. Am I right there?
Yes, absolutely. So yeah, the pastoral care, I referenced them as chaplains earlier, so sorry for the terminology switch. But pastoral care is a core discipline of hospice. And, every patient that comes on our program is assigned to a pastoral care counselor and has access to that. It's their choice whether they accept that or not. But I think they definitely round out the support and help immensely, making patients feel comfortable and heard and witnessed at the end of their life. A lot of times questions like why me come up or why him, right? It might not be the patient asking themselves. We see sometimes the patients are the most comfortable with their own death. It's sometimes the family members, maybe the spouse that's been married for 70 years and now her husband's dying. And she's saying, why him? Why can't it be someone else? Why him? And we can talk about that emotionally, but sometimes it really is a spiritual question. That kind of existential aspect of death really can be processed very well with the pastoral care counselor.
Right. Now that part of it's important. Journaling, different things like that people, at a certain point in their life should focus on to get in touch with. It's very stoic in nature, but, life does end. I mean, nobody's here forever, and we all have to put that in perspective. Actually, I want to go back to Kelly. I know the golf tournament, excuse me, not ornament. I'm getting ready for Christmas. The golf tournament is your big thing. How did it come about? I mean, that's just because a golf tournament or your family are major golfers, or
Yeah, we're a big family of golfers. Always have been. My parents both were big golfers, and my mother started it at her golf club. And then
your mother started it. I had no idea. Oh, okay.
Yeah, my mother started the outing itself. I can remember it. I was young and I can remember it, and it just developed over time. And then it became like a sought after thing after a while. Everyone wanted to play, in the golf outing, and it became, a lot of the people that have supported us are the people that support, my brother's businesses as well. So that's
right. Well, that usually, when to have a successful golf outing, you have to have an honoree, and you have to have the people doing it have connections. I mean, it works. There's no question about it. Yeah. So that in order to do business with your family, say, guess how am I going to do it? Let me take care of the hospice, and then hopefully you'll turn around and say, well, everything is equal. He's a good guy, and at the same time, he helps the family hospice.
Yes. Yeah. So it's just like I said, it's progressed over the years. It got really big for a while, and then we kind of wanted it to be, a little bit more sought after, so that we could raise more money, by increasing the foursomes and that kind of thing. And we've done really well over the years with our 100, and I think we're up to 110 golfers, and wow. It's been very successul and a very sought after golf outing every year.
Next year, I'm going to be involved in the golf outing. I'm going to be a driver for a cart, though. I don't play golf, but I want to drive one of the carts. And actually, since we are talking golf, and I'm sure Keegan's in school today, Kelly's youngest son, Keegan, is like the champion golfer in their golf club. And he's 16 or 17? 16 years old. And I saw his picture during the summer at some point. Yeah. And it was ridiculous number, like 60 something or 70 something.
I think
whatever the good golf number.
72 that day or something.
Yeah, but nevertheless, he was the number one golfer in their club. And also in his school. Doesn't he play with the school?
He does play for the school, but last year they didn't play because of the pandemic. So we don't really know where he stands at school.
That's true too. But but at the same time,
I'm not a champion golfer, but I played yesterday after the frost delay.
Did you really?
Oh yeah, we play all year round. No snow on the ground, and we play.
And Otto's also.
We actually have used a hammer and a nail to get the tee in the ground.
Wow.
Yeah.
We have a name for our group, which I won't use on this show. It's
you can tell us at the next break.
The initials.
What is it?
COB. Crazy old.
Guess what? So long as you're out there having fun, that's the other side of it. I mean, before anybody winds up,
time. I lost $1 too.
John, I do want to say one thing. When my mother put herself on hospice before her passing, she put herself on hospice in July and she passed in September. She knew what she was getting into because she had been so involved with every aspect of hospice. But the people.
And your mother was a nurse too, right?
My mother was a nurse. Yeah.
Yeah.
That was, by trade, she was a nurse before.
And she was a model. I've seen pictures of Kelly's mom going back. She was on magazine covers. She's gorgeous. But
she
anyway.
was on the cover of Look magazine. But so I just want to say that the people that come in from hospice are amazing. I can't say enough about them. She had this aide that would come in and sing to her and just be, such a presence in. They would come for, a couple of hours, like Jessica said, and it was just absolutely incredible and amazing. And the people that do this work is, how hard is it to be with somebody who, they're dying and you don't know when they're going to die, but you come in every day with a smile on your face, and they're just as happy to see you as you are them. It's very.
And it's what. You don't have to know them, but it's true love as far as I'm concerned. But unfortunately, we have to go into another break. You're listening to Senior Talk Radio here on 88.1 FM and WCWP.org. We'll be right back.
Project Independence is the Aging in Place initiative of the town of North Hempstead. Some of the many services we offer include nursing and social work services. Call 311 or 869-6311 to get more information or receive services.
Welcome back to Senior Talk Radio here on 88.1 FM and WCWP.org. This is Project Independence and You. I'm your host, John Ryan, and my co-host today is Otto Lohse.
Still
And
going.
we are having a wonderful, wonderful conversation. This is the last segment. It'll be an hour, believe it or not, with both Jessica Dunn, who is the Director of Social Work for Hospice Care Network on Long Island here, and with Kelly Tully, who is the youngest daughter of Mary Ann Tully, who is the hospice was named after, who was a hospice volunteer and really was just such a devoted person. And Kelly was sharing some stories just before the break in reference to her mom going into hospice. And do we want to go further, Kelly?
I mean, it's an incredible experience. And, the people that come in, and like I said, they're come in with a smile on their face every day. And it truly is for the families and the person that, is in the hospice itself it's amazing. And I've experienced it both at the inn and at home with both my parents. So I've had a little bit of both. It's very nice. And I can't tell you how many calls I get or emails from people who have been at the inn as well. And just thanking me and my family, for being such a huge part of hospice.
That's beautiful. And it's very important. I actually, maybe it was 10 years ago, I went through a program at the Landsberg Hospice, which is part of Parker Jewish. And I trained to be a volunteer. And I did it for a while, to be honest with you. And then I do so many different things, you run out of time. But I used to go to people's houses and keep the person company whose spouse was in the hospice. And just, maybe go shopping or something, just, for that downtime when they went home and they had nobody with them and the wife or the husband was in hospice or even hospice in the room next door. There was one situation where it was at home hospice, but the poor woman didn't know what was going on. And he just sits there for the day. So, you go in, you give him a break, you talk about stuff. I don't know anything about sports, but this particular guy was a sports nut. And I'm like, oh God, I don't know what you're talking about, but you just go, yes, it's company. At the end of the day, it's company. Did I want coffee? Did I want tea? And they're so appreciative. And that's like an organization like the Mary Ann Tully Hospice Inn and everything that's involved in the network, the Hospice Care Network. It's so important for people who don't, you don't realize it. You just said it, Kelly, people are giving you thank yous. Yes, because you never appreciate it until you go through it.
It's very true.
My mom died. My mother was born on St. Patrick's Day and she died on St. Patrick's Day, and she died 5 years ago. And coincidentally, she just went in for gallbladder surgery, never came out. She died in 5 days. My sister and my two brothers, my wife, two of my girls, one was away. Everybody was with her when she died. Because we got a phone call and, there was 20 people around her, which is, you're not always going to get that. But she knew we were there. And that's, I think, such an important thing with hospice that and this is my belief, even if the person is unconscious, I think the spirit and the soul know that there's people around who, as you said, Kelly, are singing.
Absolutely.
I hear the song. Mm-hmm. You may not think I do. Sing to me anyway. You have nothing to lose. You agree, Jessica?
100%. Yes. I think that's, what keeps people going in the difficult work that we do. People are definitely inclined to work in hospice. You can tell, the people that when someone starts working, with us, you can kind of see right away whether they're going to be a lifelong hospice person or if this is going to be just kind of a dip in their career, because that revitalizes us when we have a patient or a family that, their goal is to be together around that person, wherever they might be at the end of their life, providing them comfort, providing them care, and we're going to help them do that. So even though from the outset, it looks like a very sad situation, there's so much love, there's so much hope, there's so much joy. I feel very lucky to get to meet people that have lived amazing lives at the end of their life, and look at their pictures and hear their stories and give them that little bit of value and give them that meaning at such a difficult time. So it's going to happen anyway. We might as well help to bolster it and make it a little bit better. So that is how I think all of our staff view their jobs, that we're honored to be given that opportunity to be with someone at that vulnerable moment, and honored to and thankful to the families to partner with us to do that, because we can't do it on our own. If we don't have a family like Kelly was describing, that accepts us, that listens to us, that converses with us, we can't provide as good of a care. And especially the kind of support, Kelly's family gives us, financially through their fundraising and the amazing things they do, we're able to really provide complete care for patients. So we try to pride ourselves on not saying no. Like I said, we're a Medicare funded program. So that doesn't always encompass everything somebody needs, but having that wiggle room with the fundraising and the support really makes it possible for us to really get people what they need.
And that's so, Otto, go ahead. I'm sorry.
No, just like you, John, my mother died in 2003, and I've had a number of personal experiences with hospice, all positive. But I remember my mother, we didn't know about the Tully or the Hospice Inn, at Margaret Teets Nursing in Jamaica. And my mother wound up in there. And I remember when my mother went in, and I looked at pictures of the Tully Inn, and it reminded me of it. She went in, and I could just see a deep sigh of relief when she got into this room. It was like being in a Marriott hotel, and she looked out, and there were flowers, and I could just see my mother was really at peace now. And at that point, she was 91, 92 years old, and it felt good for me, frankly, to see her in that state, if you will. Even though she was going to die. But the people around her were so committed and so dedicated, and the difficulty, I would think, in your world to get people to do that, not everybody has that gift, if you will. So if people are inclined to go that way, boy, do it, because I think you're giving to the world a great gift if you help people through these difficult times. Like John said earlier, doing for others. Boy, there's nothing more than helping others when they're dying, if you will. It's not always an easy time. Some people can handle it and some can't. So anyhow, that's my speech.
Well, no, I appreciate that, Otto. And the other thing which I want to say, we have a few more minutes left. Otto is one of those people we have on this program. I call it, you have to own what you do. And Jessica, you just said it. I don't want the person that's getting paid and they went to a different job because they got another $5,000 raise. No, I want you to be there because you love hospice or you love being a cook. I don't really care what it is. And Otto had said it years ago. And Otto is really, he's a member of Project Independence, and he's just an extraordinary human being. And I love him. And he talked about his dad once. And his father was a milkman. A professional milkman. Makes no difference what you are. Do it from a professional opinion. Do it from the point of view that you love your job. You shouldn't be a hospice person, volunteer just to get some credit on a resume. You have to go in there and open your heart and soul to whoever it is in that bed and try to give them whatever piece. You're not going to make them healthy. There's no question about it. We know that. And at the same time, we're all going to die eventually anyway. But just have the road to death somewhat nicer. That's all I'm saying. And I'm going to go back to Kelly, and then we're going to go to Jess. But from Kelly's point of view, and I want to congratulate you and your family. I mean, we're not ending this now. We don't even, but the amount of work you do, and your brothers and your sisters, you can come up with something else. You have the ability to raise money, which is wonderful. You can give it to anybody. The fact that you're maintaining this for your mom is just, it's phenomenal.
I'm just going to go back one thing. Here we call them hospice angels. I know they really truly are angels. The people that come in, the nurses and the caregivers, the volunteer caregivers, they're angels. But I think as for us, we want to continue my mother's legacy through hospice. She was a huge integral part in building hospice to what it was. Or is, when she passed, and it's continued to grow immensely since then. So, my family and I will definitely continue to, support hospice any way we can. I know my sister-in-law does the gala. She's been chair of the gala a couple of times. So it's been,
Oh, I forgot about the gala. Right. I know you did the gala too. Okay.
Yeah.
I mean, I know you've gone to the gala.
Yes. Yeah. We've gone to the gala many years.
Right. But you have to do what you can at the end of the day. And then you have someone like Jessica who is running the show. Honestly, it's the truth. I mean, this is a perfect match because you need somebody like the Tully family, who's out there trying to support it with love and money. And then you have Jessica with love and skill, trying to get the best possible care for the people who are utilizing hospice. Because and that's got to be rough because you want to open your heart, but you realize it's going to get hurt every day because tomorrow I'm going to walk in and see that Susie's no longer here. She died during the night, or Eddie's not going to be there, whatever. And it's heartbreaking, but you still have to give it your all every day. Right, Jess?
Absolutely. And I think, the way we look at it is if we can make it better for the patient and the family, if we can make it so they can be present, feel their emotions, go through it together. And we know then the people that survive this death are going to be better off and live richer lives and have better relationships with their family, then it's all worth it for us. That's really what we strive to do. It's not about us. It's about the patient and the family. So it might make us a little sad. We are human. And we do this job from our heart, but we also have to be maintaining that outlook that it's for the patient and for the family. And I want to just mention that, yes, Kelly's family immensely fundraises for us, and that's amazing. But also the awareness and the word that they spread about hospice is so important too, because that's something we're always trying to. And I thank you so much for having me on today, because I think there's a large group of people that could really be benefiting from our services that maybe are scared of the terminology, scared of the word hospice. And I think the fact that Kelly's family is getting the word out to so many people with their golf outing, with the people they know, by their support of the gala and everything, they're trusted people in the community, and they're, really letting people know what the service is and not to be scared of it. That's such a huge help. And I thank you, John, for contributing to that today too, because I think people need to know that we're here for them, not just in the last couple hours.
Yeah.
Right. I'm agreeing 100%. Again, the number for Jessica is 516-832-7100, and that's for anything. So even if you want to get involved next year in the golf outing, or you want to go to the gala, or you want to go to anything, you just call the number, and whoever's answering the phone will get you in touch. Right now with the pandemic, it's terrible, and we're going to be this way until June. That's my guess. I have no idea. Vaccine will roll out, et cetera, et cetera. I have one person yesterday who I was told died from COVID, who I went to actually grammar school with. And another friend of mine is in the hospital. And that's just in 2 days. That it's just, I sent something out to a couple of clients the other day. We have, on a daily basis, as many people dying who died in the World Trade Center bombing, 9/11. We were over 3,000 a day almost. That was such a big deal, and it was. And we have that number dying on an annual basis. But anyway, I want to thank you both very, very much. We're basically out of time. I told you, this flies. The hour goes so fast. I will have you both back again because this is just so much information. You're two wonderful, wonderful women. Jessica, I want to thank you for all the work you do, your hands-on work with the people. And Kelly, all the work that you and your family do to get the money together to keep Jessica going and to keep everybody, honestly, at that point in time, to keep everybody finding as peaceful a death as you possibly can. And that's what it is, because we're all going to die. That's basically it. I want to thank you all very, very much. Have a wonderful weekend. You've been listening to Senior Talk Radio here on 88.1 FM and WCWP.org.
Like what you hear? Here's how you can let us know. Give us a call at 516-299-2626 or email us at info@wcwp.org. Like us at facebook.com/mywcwp and leave a comment or tweet us at mywcwp. We welcome all kinds of feedback. To directly support the podcast you just enjoyed, leave a review on Apple Podcasts. And if you'd like to give back, visit wcwp.org and click the support tab. Thanks for listening from your friends at WCWP.